There are moments in medicine that stay with you forever. Sometimes it isn't a dramatic emergency, it isn't a heart attack, it isn't a stroke. Sometimes it's simply a quiet change that almost everyone overlooks. After caring for older adults for more than 35 years, I've learned that our bodies often whisper long before they shout. Today, I want to share 5 subtle warning signs I watch very carefully in my older patients. Not because these signs mean someone is dying, but because they may signal that it's time for a thorough medical evaluation and more support. Some of these signs are surprisingly common. Most families miss them. Let's begin. I'm Dr. Alan Mercer. I've spent my career working with older adults and their families, in hospitals, in clinics, and in quiet living rooms where the real conversations about aging actually happen. And before we go any further, I want to say something clearly, because it matters more than anything else in this video. None of the 5 signs I'm about to describe, on their own, mean that someone is in their final year of life. Not one of them. Many of these signs have causes that can be treated, sometimes easily. What they really represent is a signal, a nudge, a reason to sit down with a doctor and ask better questions. My goal today isn't to frighten you. It's to help you see what I've learned to see, so that you or someone you love can get help sooner rather than later. The first sign is one that families almost always explain away, and it's an unexpected loss of interest in eating and drinking. Let me tell you about Margaret. She was 82 years old, sharp as a tack, the kind of woman who did the crossword every morning before her coffee had even finished brewing. Her daughter called my office because, in her words, Margaret just wasn't herself. She'd always loved cooking, but over a few months, she stopped making full meals. She'd nibble at toast. She'd forget to drink water unless someone reminded her. Her daughter assumed it was just a phase. Maybe she was tired of cooking for one. Maybe her taste buds were changing with age. Those things do happen. But when we sat down together, I asked Margaret more questions, and what emerged was something deeper. Her appetite hadn't just changed, it had quietly disappeared. Here's what's happening physiologically when this occurs. As we age, several systems that once worked together seamlessly can begin to fall out of sync. The senses of taste and smell often become less sharp, so food simply isn't as pleasurable as it used to be. But appetite loss can also be driven by something more serious, like an underlying illness the body is quietly fighting, a medication that's dulling hunger as a side effect, or depression, which in older adults doesn't always look like sadness. Sometimes it looks exactly like disinterest in food. When someone stops eating and drinking adequately, the consequences build quickly. Weight loss leads to muscle wasting, which we call sarcopenia in medicine. Losing muscle isn't just about strength, it's about resilience. Muscle is what allows the body to recover from illness, surgery, even a bad flu. Without enough of it, the body has less reserve to draw on when something goes wrong. Dehydration compounds this, affecting kidney function, blood pressure, and even thinking clearly. Families often miss this sign because it happens so gradually. A parent skips lunch one day, and it doesn't seem alarming. But when I see this pattern in my clinic, I look for the underlying cause. Is there a swallowing problem we haven't identified? Are dentures fitting poorly? Is a new medication suppressing appetite? Is grief or loneliness playing a role? Sometimes the fix is as simple as adjusting a prescription or bringing in a dietitian who understands the unique needs of older adults. Other times it requires a broader medical workup. Either way, this is never a sign to simply watch and wait. If you notice this pattern in someone you love, the most caring thing you can do is bring it up gently, without alarm, and encourage a visit to their physician. Something as ordinary as, "I've noticed you're not eating like you used to. Can we talk to your doctor about it?" can open a door to real answers. Margaret, by the way, turned out to have a very treatable thyroid issue that was suppressing her appetite. Once we adjusted her medication, her love of cooking came right back. I share that not to minimize the importance of paying attention, but to remind you that so many of these changes have a name and a treatment waiting to be found. Which brings me to the second sign, one that's often mistaken for simply getting older. And that's extreme fatigue that doesn't improve with rest. George was 79, a retired mechanic who had spent his whole life fixing things with his hands. His wife brought him in because he'd started napping 3, sometimes 4 times a day, and even after a full night's sleep, he woke up exhausted. He'd always been an early riser, out in his garage by 7. Now he could barely make it through breakfast before he needed to lie back down. This kind of fatigue is different from the tiredness we all feel after a long day. It's a deep, persistent exhaustion that sleep doesn't seem to touch. In geriatric medicine, we think carefully about what could be draining someone's energy at a cellular level. The heart might not be pumping as efficiently as it once did, meaning less oxygen-rich blood is reaching the muscles and brain. The lungs might not be exchanging oxygen the way they used to. Anemia, a shortage of healthy red blood cells, is remarkably common in older adults and is often overlooked, yet it can leave someone feeling utterly drained. Chronic illnesses, whether it's diabetes, kidney disease, or something else entirely, place an ongoing demand on the body's limited energy reserves. There's also a concept we call frailty, which isn't just a word for being weak. It's a specific clinical state where the body's ability to bounce back from stress, whether that stress is an infection, a fall, or even a minor surgery, becomes significantly reduced. Fatigue that doesn't improve with rest is often one of the earliest and most telling signs that frailty may be developing. Families frequently attribute this kind of exhaustion to simply slowing down with age. And it's true that energy levels naturally shift as we get older, but there's a meaningful difference between mild tiredness and the kind of fatigue that stops someone from doing the things they've always loved. When I evaluate a patient like George, I look closely at blood work, heart function, thyroid levels, and medication lists, because sometimes fatigue is a side effect hiding in plain sight. The encouraging news is that fatigue, even when it feels overwhelming, is very often addressable. George, it turned out, had significant anemia related to a slow gastrointestinal bleed we were able to identify and treat. Within weeks of treatment, he was back in his garage, tinkering with an old radio, full of the energy his wife hadn't seen in months. If someone you love seems chronically exhausted in a way that feels different from their normal rhythm, please don't dismiss it as simply a natural part of aging. Encourage a full evaluation. Energy is often the first thing the body sacrifices when something deeper needs attention. The third sign is one that touches families emotionally in a different way because it can feel like watching someone slowly disappear. It's a noticeable withdrawal from family, hobbies, or conversation. Helen was 84, a woman who for decades had been the beating heart of every family gathering. She played bridge every Thursday. She called her grandchildren just to chat. But over several months, she stopped answering the phone as often. She skipped bridge, then skipped it again. Her daughter told me, almost in tears, "It's like the volume on my mother has been turned down." Withdrawal like this can stem from several different sources, and part of what makes it tricky is that they can overlap. Depression in older adults often doesn't present the way we expect. Instead of visible sadness, it can look like apathy, disinterest, or simply pulling away. Early cognitive changes, including the earliest stages of dementia, can also cause someone to withdraw because conversations that once felt effortless suddenly feel exhausting or confusing, and it's easier to avoid them altogether. Social isolation itself becomes a kind of downward spiral. The less someone engages, the harder engaging becomes, and the harder it becomes, the more they withdraw. There's also something called delirium, an acute state of confusion that can be triggered by infections, medication changes, or even hospitalization, and it can look remarkably like withdrawal or personality change from the outside. This is why any sudden shift in someone's engagement with the world deserves medical attention rather than a shrug and an assumption that she's just getting older. Families often miss this sign because it happens in inches, not leaps. A missed phone call here, a skipped gathering there. It's only when you step back and look at the whole picture that the pattern becomes clear. When I see this in my patients, I want to understand the full context. Has there been a recent loss, a change in living situation, a new medication? Is there a cognitive component we should screen for? Sometimes the answer involves treating an underlying depression, which responds well to both counseling and, when appropriate, medication. Sometimes it means catching cognitive changes early enough to plan and adjust rather than react. For Helen, we discovered a combination of grief she hadn't fully processed after losing her sister, along with a thyroid imbalance affecting her mood and energy. With treatment and some gentle encouragement from her family to slowly re-engage, Helen returned to her bridge table within a couple of months, and her daughter told me the volume, as she put it, had finally come back up. If you notice someone you love pulling away from the people and activities that once brought them joy, please don't wait to see if it passes. Reach out, ask questions, and bring it to their doctor's attention. The fourth sign is one that families often notice physically before they notice it emotionally, and that's increasing falls, difficulty standing or walking becoming dramatically harder. Robert was 81, a man who had walked 2 miles every morning for as long as anyone could remember. But over a few months, his son noticed something troubling. Robert started holding onto furniture as he moved through the house. He fell twice, both times explaining it away as simply not paying attention. His morning walks shrank from 2 miles to 2 blocks, then stopped altogether. Mobility changes like this are rarely about a single cause. Sarcopenia, that loss of muscle mass we discussed earlier, plays a significant role because weaker muscles struggle to support balance and stability. Neurological conditions can subtly affect gait and coordination long before other symptoms appear. Vision changes, which often go unaddressed because people assume their old glasses prescription is close enough, can dramatically affect someone's confidence and safety while walking. And medications, particularly ones that cause dizziness or drops in blood pressure, are an underappreciated cause of falls in older adults. What makes this sign especially important is what falls can trigger. A single fall in an older adult can lead to a fracture, and a fracture can lead to hospitalization, and hospitalization itself carries real risks, including a rapid loss of strength and independence during recovery. This is why, in geriatric medicine, we take falls extremely seriously, not as isolated accidents, but as signals that deserve real investigation. Families sometimes explain away falls the same way Robert did, as a moment of carelessness rather than a symptom worth exploring. But when I evaluate a patient after a fall, I'm looking at strength, balance, vision, medications, blood pressure regulation, and neurological function, because falls are almost always a message from the body that something in this complex system needs attention. For Robert, it turned out that a blood pressure medication, appropriate when it was first prescribed years earlier, was now causing his blood pressure to drop too low when he stood up, a condition called orthostatic hypotension. Adjusting his medication, along with some targeted physical therapy to rebuild strength and confidence, allowed Robert to return to his beloved morning walks, though these days his son often joins him. If someone you love has started falling more often, or if walking has become noticeably harder, please don't wait for a serious injury to take it seriously. A conversation with their doctor, and often a referral to physical therapy, can make a profound difference. The fifth and final sign is one I watch especially closely in my hospital rounds, and that's repeated hospitalizations or infections that take much longer to recover from than they used to. James was 86, and his family described him to me as someone who never got sick. But over the course of a single year, James was hospitalized twice for pneumonia and once for a urinary tract infection that had spiraled into something more serious. Each time, his recovery took longer than the last. After the first hospitalization, he was back to his usual self within a couple of weeks. After the third, it took nearly 2 months, and he never quite regained the same steadiness he'd had before. This pattern reflects something important about how the immune system and the body's overall reserve change with age. As we grow older, the immune system becomes less efficient at recognizing and responding to threats, a process researchers sometimes refer to as immunosenescence, alongside a related process called inflammaging, where the body maintains a low, chronic level of inflammation that can quietly tax its systems over time. Combined with reduced physiologic reserve, the buffer of strength and resilience the body normally draws on during illness, this means that infections which might have been minor inconveniences at 50 can become serious, prolonged battles at 80. Families often notice that recovery times are stretching longer and longer, but they don't always connect the dots between separate hospital visits. Each infection gets treated as its own isolated event, when in reality, the pattern across time tells an important story about someone's overall resilience. When I see a patient like James, I want to understand what's happening beneath the surface. Is there an underlying issue making infections more likely, like poorly controlled diabetes, or an undiagnosed swallowing difficulty that's leading to aspiration pneumonia? Are there ways we can strengthen his overall health between illnesses, through nutrition, physical therapy, or careful medication management, so his body has more reserve to draw upon? This is often where a comprehensive geriatric evaluation, sometimes bringing together a whole team, becomes so valuable. For James, we identified a mild swallowing difficulty that had been quietly increasing his risk of aspiration and subsequent pneumonia. With some targeted therapy and adjustments to his diet's texture, along with closer monitoring, his infections became far less frequent, and his family finally felt like they could exhale. If someone you love seems to be bouncing from one illness to the next, with recovery taking longer each time, that pattern deserves a real conversation with their care team, not just treatment for whatever infection happens to be active in the moment. Now, I want to return to something I said at the very beginning, because it matters too much to only mention once. None of these 5 signs, appetite changes, persistent fatigue, social withdrawal, increasing falls, or repeated infections, predict with any certainty that someone is in their final year of life. I have seen patients with several of these signs at once go on to live for many more meaningful years, once we identified and treated what was actually going on. What these signs really represent is an invitation. An invitation to look closer, to ask better questions, and to advocate for a thorough medical evaluation rather than assuming that decline is simply inevitable. Growing older doesn't mean giving up, and it certainly doesn't mean giving up on answers. So many of the causes behind these 5 signs, thyroid imbalances, anemia, depression, medication side effects, swallowing difficulties, are treatable, sometimes remarkably so. The families who catch these changes early and who bring them to a doctor without waiting are often the ones who see the most meaningful improvements in their loved one's quality of life. If any of what I've described today sounds familiar, whether it's in your own life or in someone you care for, my encouragement is simple. Don't wait and don't try to diagnose it yourself. Bring it to your physician. Ask for a thorough evaluation. Advocate gently but persistently for real answers. And if this video helped you see something in a new light, please consider sharing it with someone you know who's caring for an aging parent. Sometimes the most important thing we can give each other is simply the encouragement to pay closer attention together. I'm Dr. Alan Mercer. Thank you for spending these moments with me. Take good care of yourself, and I'll see you in the next video.